Hi, this is Joyelle Clance, Director of Biz Events, and we're talking about our upcoming Excellence in Healthcare Awards taking place at the beautiful Welch Allen Lodge in Skaneateles on October 20th. Did you know nominations are running currently across Central New York region? We're talking about why you should nominate, and we are at the offices of Summit Realty Management, and we have some special guests that are going to convince you why you should nominate and attend the event. I'm going to let my guests introduce themselves. Scott?
My name is Scott Brennan. I'm the Vice President and Director of Business Development with Bankers Healthcare Group here in Syracuse, New York. We have about 310 employees. We specialize in providing commercial working capital, personal lending, MasterCards, and insurance to healthcare professionals nationwide. There's also an office domiciled in Fort Lauderdale, Florida, and in Manhattan. Happy to be here, and we are the presenting sponsor, I believe, for the fourth year?
Fifth year.
Fifth year, okay.
Hi, I'm Dr. John Marola. I'm Chairman of Summit Realty, formerly President and CEO of the North Medical Center, North Medical PC, which is our professional corporation that ran the healthcare division. Presently, I'm retired from medicine and doing part-time work, as I call it part-time, with Summit Realty and mostly medical real estate. I was a recipient of the award last year, and I can encourage everybody to look over their shoulder and see who they want to nominate and who I will be able to participate in presenting that award this year. It was an honor to receive that award.
That's right. Dr. Marola received the Lifetime Healthcare Achievement Award, a brand new, very important award to our community, and he will be presenting on October 20th to our new honoree. So go to bizevents.com at BIZEVENTZ, remember those Z's, and you can nominate until August 31st. We've extended the deadline. We know summer's a little bit busy, and we want you to look into the healthcare field, nurses, doctors, physicians, EMTs, therapists, nurses, dentists, you name it. We have a wide range of categories. So check out our website and learn more. Scott, you have been our presenting sponsor, and we thank you so much, yourself and Bankers Healthcare Group and your team, for helping bring this event back to the community each year. Why do you continue to support this event?
Well, first of all, it's a privilege that Bankers Healthcare Group is asking me to continue in this role. I do very much so enjoy it. The importance of healthcare professionals, as Dr. Marola has been mentioning here casually as we were discussing, is critical to any area, any demographic. We're very pleased to be involved for the fifth year, and we certainly expect to continue supporting the area. As I mentioned earlier, we work exclusively with healthcare professionals, so we recognize the importance of having them in our communities. And one of the primary reasons why we nominated Dr. Marola last year was because of his forward thinking. Ambulatory surgery centers today have grown vastly across the country, nationwide. So for him to have seen that need where the general population of middle-class America has moved out into the urban areas, the perfect example is what he's done here in the Syracuse space with his medical practice, and as well as his business development aspects as it relates to not only his medical profession but his business acumen. I would turn to you, Dr. Marola, if you wanted. You mentioned a couple of wonderful things as you delineate the differences between the medical and the business side of what you've accomplished in your career.
Well, medicine is both business and a profession. It starts out as a profession, and you go through the rigorous medical training from high school to pre-med to medical school to residency training, and then you find yourself as a businessman. You have to hire employees, you have to pay rent, you have to buy insurances and utilities and malpractice and collect money and deal with insurance companies, et cetera, et cetera, et cetera. So you end up running a small business. And so you have to wear two hats. As a businessman, I have one of my grandsons just starting a dental practice. And I spoke with him yesterday as an example, giving him some advice and the business side.
Sure.
I can't teach him much dentistry, but he certainly has had some great training. But there's both, medicine is both business and it has a major impact on a community. I think our gross national product now is healthcare is something like 15, 16, 17% of everyone that works in this country works in some kind of healthcare facility or in some way related to healthcare. From the big pharmaceutical companies, to all the physicians, to the hospitals, to all the support staff, to nursing, to therapists of all kinds, to surgical technicians, to all of the medications and pharmacies. It's a massive part of our economy. And it means a lot to people. After all, it's all about us as an individual.
Right.
Why do we take a medicine? Why do we have surgery? Why do we go see a physician? For any reason. It's to better our health. Without our health, we don't have much. And so there's a massive support staff in this country. And people sometimes criticize our healthcare system, that it's too expensive and it takes up too much of our economy. But I guess if we had to, and I'm a golfer, so I don't want to pick on the poor golfers, but you spend $600 on a driver,
Right.
maybe you might be better off spending $600 on your health care so that you can go out and play golf.
Good point.
Well said.
Or ski or whatever, and I've done all the above. And so I'm not criticizing that phase, but it's a massive part of our society, and it contributes a large amount of tax base. Our tax base here alone, we calculated it back in the 90s when I first built North Medical. It was 1989, and I think from 1989, correct me, somewhere around 2001 or 2, we calculated, I had my accountant calculate all the real estate taxes we paid, because we're a private enterprise, not for profit. And we contributed to the township and to the school district here some $60 million in tax base. That used to be a cornfield here and a strawberry patch. So it contributes to the community, to the schools, to the sheriffs, to the roads, to the parks, to all the things that make up our community. As well as all the jobs we produced. At our peak, I had 960 employees here on North Medical campus at my peak, and that's not considering all the other physicians in the building. So we're well over 2,000 or 3,000 here, having over 8,000 cars a day come here for people. So it became a big enterprise and a big part of the community. I was very happy last year to receive that Lifetime Achievement Award. Anytime you receive any award, I guess you look at yourself and say, did I really deserve this? Did I really do all these things? Or you question yourself. But it was an honor, and I respected the Bankers Healthcare Group for doing it. And the more I thought about it, the more I was excited about it.
Yeah.
And I think anybody would be excited to receive that award. I've received other professional awards, and I've received awards on the business side. As I said, you wear two hats as a physician, both the business, and it's a reality. When you speak to you guys about financing your new equipment that you need,
Right.
your new electrocardiograms and echocardiograms and all the other fancy computers and everything we have in medicine, it has to be done soundly, and it has to be done on good business terms, and you have to be able to afford it.
Right.
And you need sometimes some guidance in that. We're not trained in that very well in medicine. Medicine is so all-consuming. Physicians get put in a cocoon, as I call it. They're in a cocoon for 8 or 10, 15 years, depending on their specialty. And they're all wrapped up in that cocoon. And then they get in the outside world, and they're not ready for it.
Right.
They're really not ready for it. They need some help from outside people. I've seen all that in my career, as well as I told you some stories earlier about some wonderful professional successes we've had in medicine, which, by the way, I told you a story about a patient that I had from age 57 to 97, and he never thought he was going to make it from 57 to 58. And he had heart disease, and I won't discuss the entirety here. However, to diagnose that heart disease, I used a cardiac stress test machine that I had to finance because I couldn't afford to buy it at the time.
I'm
And
sure.
I financed that cardiac stress test machine, and then promptly after he had an arrhythmia on the stress test machine, we referred him to cardiology and subsequently had open heart surgery. However, you try to integrate business and medicine, it's a reality.
Right.
It's a reality that takes place every day. It's a decision someone has to make, and you have to make sound decisions. So I was able to blend both together.
Well, you've really covered so much ground, and we can't continue to say thank you for what you are doing for our communities. You know, this award covers across Central New York, so if you're from Syracuse, Greater Syracuse, you're from the Mohawk Valley, Binghamton area, even up in Watertown and North Country, we invite you to nominate. Join the efforts behind Dr. Merola and others in the medical field. Join Bankers Healthcare Group, the Business Journal News Network, and Biz Events, and visit our website. Don't miss this opportunity and nominate by August 31st. Any just quick last minute comments, gentlemen?
Doctor?
Well, I can just say that it was a great time in my life and something I have great respect for. And I encourage everybody to think hard and nominate somebody that you know well, and I know that person will be very excited about receiving that award.
And please do join us because it's a lot of fun and we look forward to seeing you there. Thank you.